It looks like this, but it broke. So that's why the veneer's on it.
I'm gonna do something with you. The main idea is to get rid of the root canals and the implants, right? Over here, what we have is a stain because of the oxidation of the implant. Of course, when you have a metal, that metal always gonna have particles, and all those particles are like absorbed by the gum. Okay, that's why if you see, there is nice and pink, and this one is a little bit darker, a little bit gray. So in this strip, what we're gonna do is to remove this, right, and do a new one. We can maybe work a little bit in the cosmetic, just temporary, but we can work in order to reduce, because I want to tell you, the main problem that we have here is that almost the three teeth have the same height.
Right.
And the normal is to have the central
Right.
and the incisor have to be a little bit shorter and narrower. So over here, if you see, this one is even a little bit more narrow than the central also.
But that's just the veneer.
That's the veneer, yeah. I think the prosto, prosto is the cosmetic dentist. She'll help me in the cosmetic here, just for the next 4 months. But she'll help in this. Okay. What else we have? I'm gonna check the CT scan. I think you have some crowns here. Another crowns here. So we're gonna check everything right now. Okay. And based on that, we're gonna see the plan. Here. We have some necks of teeth. ¿Ya le hicieron el diagnóstico? No. Okay, right now we're going to do the diagnose, a couple of pictures, and the clinical diagnose, and based on that, we'll sit down and analyze it.
We need to avoid spitting for 5 days. It's often because you have like bloody taste in your mouth, so you feel comfortable. It's better to swallow up a little bit, or be drinking like cold, real good water. Try to not blow out the nose. Sometimes people have this like in the morning, try to take all that on. Just be very calm and gentle for a few days. If you feel like you need to sneeze because maybe the cold and the weather and stuff like that, try to sneeze with the mouth open. It's hard because we are used to do the opposite, like try to cover, but the idea is that you try to be quite gentle to avoid breaking the mucus. The day of the surgery, you don't brush your teeth, but the day after you can brush the rest of the means. It's important to keep the area clean. So maybe get a soft brush and just be gentle with the stitches. Always wash the teeth with a glass so you can grab the water, move the head, and let it go. Don't do this movement like not bouchy. No, just like real gentle. Even with the mouthwash, like real soft, real soft. The day of the surgery, the day after, the idea is that you put cold. So you can get these gel bags from the pharmacy, or you just can get just regular Ziploc bags with ice and put it. How much? How much you can handle? You grab a bag, put it in your face. When it starts hurting because it starts burning, let it go. 1 hour and a half later, another cold. But just when you are awake. It doesn't mean that you're going to wake up every 1 hour and then I just put ice. Just preventive. After the third day, then you can move to heat. In case you are too swollen and you don't like to look like a chipmunk, then you use heat, okay? Or inflammation range goes into the 4th day. So maybe the day of the surgery you get inflamed, the day after you'll be amazing, and then the 3rd day you you wake up and it's puffy, it's normal. Don't feel like it's something that you do wrong or you need to freak out. So in the first 4 days, it can get even more. After the 4 days, then will be something that we need to check out, okay? So the cold, the day of the surgery and the day after, it's only cold liquid diet. We're talking about ice cream, jellos, shakes, stuff like that. If you feel like you need to eat something that is salty, then you can get a cream, like potato cream or tomato cream, without any crumbs, and just cold temperature, like room temperature, nothing warm for the first two, the day of the surgery and the day after. Okay?
So can it be fruit smoothie?
Yeah.
Okay.
But
But no seed.
no, and with that glass, not straw, because straw increase the pressure up in the stitches and stuff like that. So just like with that glass, start drinking, try to hold it, try to drink cold water, so to really help with that. No smoking, I don't know if you smoke. And in the drips we use painkillers. It's supposed to last 8 hours, but I always recommend the patients to have a backup. So I don't know if you usually get an Advil for your migraines or Tylenol or something. It will be important that you have maybe two pills over there in case that you feel like it's in. But if you suffer from migraines, probably you have a high pain tolerance, or you can handle it by yourself. You know, it's only in case that. So just the day of the surgery and the day after, cold liquid diet, and then it will be soft diet. That is all this that we call soft diet: scrambled eggs, ground beef, tortillas, the ones that are soft, not chips like. The idea is like the idea that you get a nice dinner today. That is big beef, big fatty, because the next day they're going to be real plain food. But the idea is like let the gum chill. So right now this will be it. We're going to pass like 1 hour with that IV. Then we put the antibiotic, we put some ceftriaxone because you're allergic to penicillin. And tomorrow we'll search. Tomorrow the difference, we use the vitamin C, the antibiotic, and we put some dexamethasone for help the swelling, and the painkiller. Okay? Just for prevent you feel too cough. So see you in a while, okay?